Brooks, you about finished?
The most significant things that have changed in the last 10 years are the numbers.
Get dressed, Brooks, we're gonna take you down the floor.
Our count today is about 810, and 17% of those are mentally ill.
That could be anxiety disorder, depressive disorder, schizophrenia, having obsessive compulsive disorder and needing medications and therapy, sometimes briefly for an adjustment reaction, helping people who are trying to come to terms that they will never leave prison.
Atkins?
I think the jails and prisons are filling in the gap for services that people can't get other places. When the state hospital systems had thousands of patients, they were housed there for long periods of time, and now they don't. These people end up in the community, and for one reason or the other, they end up in the criminal justice system instead of a mental health system.
We run the largest mental hospital in the state of Kansas. The downtrodden, the homeless, those that suffer from not only mental illness but substance abuse, and they kind of run parallels, if not run together. They do tend to become involved in the criminal justice system, if for nothing else, because of their behavior.
Some patients will find that the only place they can guarantee that they will be treated is in a correctional setting. There is no constitutional right to health care if you're just in the community and you're not incarcerated. If you're incarcerated, then there's a constitutional right to have medical care.
As a matter of fact, I've had family members tell us that, I hate to see them in jail, but when they're in jail, we know that they're safe, and they are. We know that they'll be treated appropriately, and they are. And we know that they will be put back onto a regimen that we can't get them to follow. So a lot of them look to us as their safety net.
You doing okay now?
The good part about it is once they get here to our facility, we can help them out and get them pointed in the right direction.
They are our eyes and ears when we're not around, and trying to piece together just a very difficult or complicated case that you can't quite put your finger on. Having all the people involved in their care working as a team, you oftentimes will come up with the correct diagnosis so you can decide this is the correct plan of care for them.
A lot of these people are here on many, many separate bookings. Most of the time it's very low-level type crimes, misdemeanors, and I think we have a social obligation here as law enforcement to partner with the medical health field to attempt some innovative ways here to avoid that incarceration.
Mental health issues can affect anybody at any time.
It could involve the very wealthy, it involves the very poor, and everything in between. But this one thing is for sure. Over 96 or 97% of the folks that we have here today will get out. They will go back into the community, they will go home, they will go somewhere. How can we successfully reintegrate these people so they become productive, have some self-worth, take care of family?
And to look at them as a whole person, not just as you're a convict or you're an inmate. Patients that I see in prison are still people, they're human beings.
We need to change some thought processes. We need to change a little bit of the culture. And we need to do some things along the lines of saying we have to work on reentry and we have to work on a second chance. And everybody deserves a second chance for the most part,
Before they leave, we look at making sure they have prescriptions. We make sure that they know who to contact. If they can't contact the mental health center where they'll get follow-up, then there's someone they can contact within the facility, even the release planner.
If they can leave here with the tools like that, maybe they can get reacclimated into that family setting. Perhaps maybe they can get their job back. My goal here, more or less, I suppose, is our social conscience speaking out more than our enforcement abilities by saying somewhere here we've got to try to break that cycle. Well, I'm not saying we have the answer, but I'm saying we have to try.